Scot-Tussin is used for temporary relief of coughs without phlegm caused by certain infections of the air passages, such as sinusitis or the common cold. It should not be used for an ongoing cough from smoking or long-term breathing problems unless directed by a doctor. This product contains dextromethorphan, a cough suppressant that works by decreasing the feeling of needing to cough. It is important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years, so it should not be used to treat cold symptoms in children unless specifically directed by a doctor. It's important to carefully follow all dosage directions to decrease the risk of serious side effects. And remember, do not use this product to make a child sleepy, and do not give other cough and cold medication that might contain the same or similar ingredients without consulting a doctor or pharmacist. Always ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drop/spray. When taking Scot-Tussin, it's important to follow the dosage instructions provided by your doctor or on the packaging. The dosage will depend on your age, medical condition, and how you respond to the treatment. If you're using the medication without a prescription, make sure to follow the specific dosing instructions on the packaging. If your doctor has instructed you to take Scot-Tussin daily, it's best to take it at the same time each day to get the most benefit from it. Using a medication measuring device to measure your liquid dose is crucial, as using a household spoon may not provide the correct dose. If you're taking a suspension, be sure to shake the product well before measuring out your dose. It's important to take this medication as directed and not to increase your dose, take it more often, or use it for a longer time than prescribed. Misuse of Scot-Tussin can result in serious harm, such as brain damage, seizure, or even death. If you experience symptoms like fever, chills, headache, or rash, or if your symptoms last or get worse after more than 1 week, be sure to consult your doctor, as these may be signs of a more serious condition. If you experience slight drowsiness, dizziness, nausea, or vomiting while taking Scot-Tussin, those are common side effects. In rare cases, some people may experience severe drowsiness or dizziness with normal doses. If you notice any of these effects lasting or getting worse, it's important to tell your doctor or pharmacist promptly. It's important to remember that if your doctor has prescribed Scot-Tussin for you, they have determined that the benefit to you is greater than the risk of potential side effects. Many people who use this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to Scot-Tussin can occur. If you notice any symptoms of a serious allergic reaction, such as a rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. As always, if you experience any side effects, it's important to consult with your doctor. In the US, you can call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada. Before using Scot-Tussin, make sure to inform your doctor or pharmacist if you have any allergies or if you have a history of lung problems such as asthma or emphysema. This medication may cause dizziness or drowsiness. Avoid consuming alcohol or marijuana, as it can worsen these effects. Do not operate machinery or drive until you are sure you can do so safely. It's best to avoid alcoholic beverages while taking this medication. If you have phenylketonuria, PKU, or any other condition that requires you to limit your intake of aspartame, or phenylalanine, consult your doctor or pharmacist before using this medication. If you are pregnant, use Scot-Tussin only if it is absolutely necessary and discuss the potential risks and benefits with your doctor. It is uncertain if this drug passes into breast milk, so consult your doctor before breastfeeding. Now let's talk about the uses and dosage of Scot-Tussin. This medication is used to relieve symptoms of a cough and chest congestion caused by the common cold, flu, or other breathing illnesses. The recommended dosage is usually taken every 4 to 6 hours as needed. Remember to drink plenty of fluids while taking this medication. And it's best to take it with food to help prevent stomach upset. Make sure to carefully follow the dosing instructions on the label or as directed by your doctor. If your symptoms persist or worsen, seek medical attention. Always take medication as prescribed by your doctor and consult with them if you have any concerns about the best timing for taking this medication. It's important to be aware of potential drug interactions when taking Scot-Tussin. It's a good idea to keep a list of all the medications and products you use, including prescription and over-the-counter drugs, and herbal products, and share this list with your doctor and pharmacist. Avoid taking certain MAO inhibitors with Scot-Tussin, as this can cause a serious and possibly fatal drug interaction. It's also important to be cautious when taking other medications for cough, such as hydrocodone, or over-the-counter cough and cold products, as they may interact with Scot-Tussin. Always consult with your doctor before starting or stopping any medications. And remember, most MAO inhibitors should not be taken for 2 weeks before starting treatment with Scot-Tussin. If someone has taken too much Scot-Tussin and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the US, you can call the local poison control center at 1-800-222-1222. Canadian residents can reach out to a provincial poison control center. Symptoms of overdose may include a fast heartbeat, vomiting, sweating, feeling high, euphoria, hallucinations, problems walking, staggering, agitation, and severe drowsiness. Make sure to keep all of your medical and lab appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. If you forget to take Scot-Tussin at your regular time, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one and take the next dose at your usual time. Don't take double the dose to make up for the missed one. Make sure to store Scot-Tussin at room temperature, away from light and moisture, and not in the bathroom. Keep it out of reach of children and pets. Do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.